report of multiple cases of measles in the Tamale North constituency of the Northern region as the acute viral respiratory illness spreads. MP for the constituency, Al-Hassan Sohoyeni, has expressed worry about the situation and called for immediate action. Yarafa of our affiliate radio Justice reports that several health facilities have begun to detect cases. He joins us via Zoom with details. Grateful that you could find time to join us. Which facilities have you visited and what's the situation there?
3 facilities in the Tamale North constituency. So I visited the Taha Community Hospital Clinic. I also visited the Kalpohene Health Center as well as the 4 health centers. And the indications are that, for instance, at the Kalpohene Health Center, they started recording cases, suspected cases, as far back as in November 2022. And they have not been able to confirm their cases because really these facilities don't have the equipment to be able to confirm or detect the virus. And so they take samples and forward it to Accra. My checks there tell me that it's been difficult to get results for the tests they took even in November. And so there's some kind of confusion. They are not quite sure if it is actually measles, even though the cases really, I mean, the symptoms, the patients were showing symptoms of measles, and they believe that it is measles, but they were just waiting for the confirmation to come from Accra. Unfortunately, for that period of time, they haven't been able to confirm the cases. So health officials there are worried that if the situation continues, it may get worse. I mean, the number of cases we are recording here in the Tamale North constituency may get worse if we are unable to confirm the tests that are being done.
Now, you reported the situation in some households. Tell us about that.
Yeah, so I was also at the Taha community. I spoke to a number of people there. Residents say that for a very long time, they haven't reported or witnessed any case of measles in their communities. But in November, December, and especially in January, households started reporting that their family members were catching the measles. I spoke to one gentleman, Salim, who told me that he was actually infected by this measles. In fact, he was in the hospital, at the Tamale Teaching Hospital. He was actually admitted and treated for measles. When he came back home, 2 of his children also caught that disease. And because he told me that when he was at the hospital, they really didn't offer him any treatment apart from infusion. So when his kids also caught that disease, they decided to treat it locally. And hopefully everything is fine with them. But residents are scared. They are worried that, first of all, there are no vaccines across the northern region. And secondly, when you catch measles, health authorities really do not have anything to do or to any treatment measure for you. They just treat symptoms, and the residents think that it's not the best.
So what are health officials saying about the situation in the area?
So I have been trying to establish contact with the Sanargo Municipal Health Directorate. In fact, I spoke to the health director. He referred me to the regional, and for the northern region, that's the difficulty. Anytime you want an information, you'd have to refer to the regional. And unfortunately, we didn't quite get information per se from the regional outfits. They are very tight-lipped on this particular matter. But when you speak to the health officials who are on the ground, the nurses, the midwives, they are able to open up a bit to you. And they are the ones who are worried that if something is not done immediately, we could start reporting deaths.
Grateful to you for joining us with those updates. The Member of Parliament for Tamale North, Al-Hassan Suhuyini, has expressed fear over the possible closure of schools in his constituency following the outbreak of measles and a shortage of vaccines in parts of the country. Now, reports suggest 3 essential vaccines against childhood killer diseases are lacking in hospitals nationwide, putting the lives of babies at risk. A 72 million cedis released to the Ministry of Health for the purchase of these essential vaccines for babies cannot be accounted for. This is despite the confirmation by the National Health Insurance Authority that the last tranche of the money was paid in January this year. Oswald Esua-Mensah is NHIA's Acting Corporate Affairs Director.
Well, from an NHIA standpoint, let's understand that we are just payees or payers in the architecture of this vaccine procurement. So once we have made payments available to the ministry, I guess it will be difficult for me to explain why the vaccines have not been supplied. But as I said, of course, you know that our budgets go through Parliament around the same time, which is always around February, March. And once it gets approved, we wait for instructions from the Ministry of Health to release this funding. And this funding, as a matter of fact, goes to the UNICEF. There's a program which this falls under Government of Ghana's co-funding obligations, to purchase these drugs and devices and other commodities. So it comes under the Gavi arrangement. So these payments are actually released to the UNICEF, and between UNICEF and the Ministry of Health would make sure that the procurement of these vaccines are available. I can tell you that we did payments in June, October, November last year, and I think the last tranche must have been paid in January 2023 for that component under support to the Ministry of Health.
Now, the Health Committee of Parliament's request for the Minister of Health to appear before it to answer questions about the disturbing trend on Tuesday was not honored. Speaking to Joy News after making a statement on the floor, Al-Hassan Suhuyini described the situation as regrettable, expressing fears the situation may lead to the closure of schools in his constituency if the vaccines are not immediately made available.
We are having to deal with an outbreak of a disease, not isolated cases of a disease that we should have, completely eradicated in 2020. We are in 2023, and we are dealing with an outbreak, especially in the midst of the concerns that we do not have essential vaccines to deal with it. We, as a country, have developed, a robust system of immunization, and we have become, a case study for our peers in the sub-region when it comes to deployment of immunization. So it is so regrettable that we have all these things in place, but for lack of resources, I believe, or proper planning, we do not have the essential vaccines, and we are, seeing a retrogression in the gains that we have made over the years as far as the eradication of measles is concerned. A couple of months ago, the Tamale Central Hospital had to shut down the pediatric unit because of the outbreak of measles. And if care is not taken and this addressed aggressively, we may see the shutting down of schools, very soon, because these children do not even know how to observe some of the hygienic things that they are supposed to observe in order to limit the spread of measles. You are talking about runny nose, and it is usually prevalent, with children between the ages of 4 and 14. So they don't even know how to control runny nose and all of that. So if they go to school and they have these symptoms and they have these conditions, you can just imagine how many kids are at risk.
Pharmacist Harrison K. Abutiate is chairman, Ghana National Chamber of Pharmacy, and he joins us via Zoom now. Grateful to you, sir, for joining. Now, what's your take on this development?
Well, I didn't join you at the beginning, but I assume that you're talking about
the shortage in vaccines.
Yeah, it's a rather serious situation we are in now, because these vaccines are supposed to prevent some diseases, especially in childhood diseases. And honestly, I don't know why these shortages have come about. It could be delay in supplies, or maybe some orders may not have been placed on time, or something else. I don't know. I really don't know. But there shouldn't have been that shortage. Yes.
Okay. Now, so why haven't we been able to start production of vaccines on our own as a country?
It's just because it's not that easy to start vaccine production. But it's a question of deciding what the priorities are. Because, as you know, even in this age that we're talking about COVID vaccine, it's not that easy. We cannot start from scratch. We may have to bring in the vaccine and repackage it here in case of the COVID. With the older vaccines, like the childhood vaccines, normally it's the WHO and UNICEF who provide some of these as grants and donations, to nations. So it may not have been taken as a serious area to get involved in if you are going to get donations from the UNICEF or WHO. But as things are now, it shows that there are some things that we can get for free, but the others we have to start thinking how we produce them. And the older vaccines maybe are easier to start with because they are urgent. I mean, if your child doesn't get vaccinated like we've seen, and they get measles or polio or any of these childhood diseases, then it's a very serious situation the nation is dragging itself into.
Now, since this is a capital-intensive venture, like you state, can't 2 or 3 companies collaborate and achieve this?
Well, in Europe and advanced countries, yes, there are collaborations like that going on. Unfortunately, we don't have such collaboration among our manufacturers, except recently when we talked about the COVID vaccine. And like we said, it's not that easy to start vaccine production. It's a very skilled area. And some of the skills required and the quality control issues that go on need to be done and practiced properly. Otherwise, you are going to introduce other contaminants and start something else. Yes.
So what's the latest on the Vaccine Institute, and will it change the narrative?
Oh, yeah, definitely. Once we have an institute that is producing vaccine, we can introduce the others. And to me, then would have had the personnel, would have had the facilities. And if we are producing enough, we could bring down the cost of production. And that would be helpful. In fact, we should be thinking of producing the basic products, not only vaccines, but even basic drugs. As COVID has shown, you can't depend on other countries. So we must try to support the production of basic drugs, basic vaccines. I mean, we have malaria prevalent in this country. It's only now we've started malaria vaccination or doing the trials. And it's possible that if we do well in this area, it could be a way of maybe exporting to other countries that have malaria. But Europe, they don't have malaria. So maybe they're not very keen to do anything about it except to export it to developing countries like ours. Yes.
Okay.
Yes.
Now, with your experience, where do you think we have to start from if we are to start producing our own vaccines?
Well, stage one is what we are doing. We've started an institute. We have to train the people. We have to have our priorities. What vaccine do you really want immediately in the system? And like we said, the childhood disease vaccines are important. Then the malaria vaccines are important. Anti-snake vaccines should be one of the priorities also. And of course, the COVID has now come. So it's a priority also now. But it's sad to say children who maybe because there's no vaccine for them, they develop polio, and they have to go through life for the rest of their lives paralyzed. So that's we must just identify the key areas that are important for the nation, and then go into the how we can produce some of these vaccines in those areas. Yes.
Grateful to you for joining us now to